McConnell protected the Republican candidate Karen Handel in the Georgia congressional election by refusing to release any details of the health care bill until after that election. Senator McConnell says voters in the Georgia 6th congressional district and the rest of the country can find out what he has in mind for their health care on Thursday of this week. Joining us now, Ezra Klein, editor-in-chief of Vox.com, and Sam Stein, senior politics editor of Huffington Post, soon-to-be politics editor of The Daily Beast. He's also an MSNBC contributor. Ezra, as of 10:21 p.m. tonight, what do we know about the Senate bill?
We don't know a ton about its details, but I think we know its broad outlines, which is like the House bill, what the Senate bill is going to do is take hundreds of billions of dollars we are currently spending to provide health insurance to poor people, and it is going to move that to provide tax cuts to rich people. That is the core of the first bill. It's going to be the core, as from everything we can tell, of this bill as well. It's going to cause massive disruption in the healthcare system. And one point I want to make, because I think this has been underplayed in coverage, Republicans keep saying, and this is really what I hear when I talk to them on the Hill, that they need to pass this or something like it because they promised to repeal and replace Obamacare. When they promised that, they also told their voters, and all voters, that they were going to get more coverage. Donald Trump said everybody's going to be covered. Mitch McConnell said the problem with Obamacare is that there's 25 million people uncovered. And they said there'd be lower deductibles and lower copays. And this bill does none of those things. It's going to have fewer people covered, higher deductibles, higher copays. So it is a breaking of that promise. And there's no reason to think the Senate bill will be any different than the House bill on that score.
We know that Democrats are unsatisfied with the process. We know that the Democrats are all complaining about being shut out and having no information about this bill. Republicans are making the same complaint. Let's listen to Senator John McCain.
Senator McConnell, you must be very confident that this bill is going to pass, number one. And number two, are you willing to burn a reconciliation package if it's not?
We're going to make every effort to pass a bill that dramatically changes the current health care law.
But that's not confidence, necessarily. I mean, you wouldn't bring a bill up unless you were confident, right?
Are you satisfied with the process? You don't think it right now? Of course. Why not?
For the obvious reason that no one is being shared. It used to complain like hell when the Democrats ran the Affordable Care Act. Now they're doing the same thing.
That's a lie.
Sam Stein, at least one Republican is consistent about this.
Well, yes, I think the complaints about process that we're hearing now, though, are a bit of a smokescreen. And in the end, a lot of these senators will end up voting for a bill, even if they have concerns of the process. I think the one quip I would take, the one criticism I would have about McCain's statement is that he said at the end of it that Republicans are now doing the same thing that Democrats did in 2009, 2010. In fact, the process in 2009, 2010, while it was much maligned by Republicans, was objectively open and transparent with regards to any passage of major legislation that you can imagine. There were dozens of committee hearings, dozens and dozens of amendments that were offered. I'm sure Ezra has the exact numbers probably in the back of his head, but it was widely open. I mean, if you remember at roughly this point in time in constructing that health care bill, Barack Obama was bringing Republican leaders to the Blair House so that he could hear their ideas and then turn some of those ideas. So it's not the same as what's happened in 2009, 2010. It's demonstrably worse.
Mike Lee is one of the people who was on this just quickly assembled group of people. I don't want to call it a committee because it is not a Senate committee. There is a Senate committee who has jurisdiction over this, but they've been ignored. And let's listen to Mike Lee's complaints about this.
I've had a lot of people ask me specifically when the health care bill is going to be released to the public, why it isn't public. This to help narrow some of the focus of this. I haven't seen the bill, and it has become increasingly apparent in the last few days that even though we thought we were going to be in charge of writing a bill within this working group, it's not being written by us. It's apparently being written by a small handful of staffers for members of the Republican leadership in the Senate. So if you're frustrated by the lack of transparency in this process, I share your frustration. I share it wholeheartedly.
Ezra,
still
how can
vote for
senators
it.
make statements like that and then find their way to voting for this?
I think that statement's so amazing. I am part of the secret working group. If you are frustrated by secret working groups, just know I'm not part of the super secret working group, and have now decided that you are right, and I share your frustration. Look, I think there's a big point to be made about all this, which is that there is a reason Republicans have kept to a very secret process here. Sam brought up, I think, properly the Blair House event in 2010, I think it was. And at that moment, what happened was the Affordable Care Act was under fire. Its passage looked at the very least hazy. Barack Obama, President Obama, then invited Republicans and Democrats to the Blair House for a nationally televised multi-hour debate over the bill. And the reason he did that was the Democrats believed then and at every point during that no matter what the polls said, if they could tell the American people what was in their bill, that the American people would like it. Republicans have exactly the opposite belief. They believe that if the American people have time to look at what is in their bill, they will not like it. And so the best thing to do is to pass it as quickly as possible, with as little debate as possible, and move on from it forever. And that is a approach that just, it's grotesque when you're dealing with the healthcare and the lives of this many people. To pass something you know people are going to hate and keep it secret because you know it wouldn't survive if you didn't, that's just not a moral way to do this.
Yeah, Sam, there's only one reason why you keep legislation secret, and that is that you know from the moment you make it public, you are only going to lose votes.
Yes. I mean, what I hear when I talk to any healthcare activist or staffer on the Hill working on this issue, both sides of the aisle, is that we're essentially witnessing is a game of legislative hot potato. No one wants to own this thing, and so they keep passing it along to someone else. The House got it out of their chamber, thankfully, to give it to the Senate. Now the Senate doesn't want to be touching this thing, but they're probably, in likelihood, going to pass it, get it to the conference committee. At some point, this thing either fails or it passes through. So Ezra's right. They want to get it done, they want to get it passed and move on quickly. But at some point it does become law. And at some point that law, which is polling in roughly the mid to low 20s, will have a tangible impact on people, and there will be a political price to pay, presuming that they can't get those numbers up. It's just no one wants to pay that price now, no one wants to see it go down for defeat.
Ezra, as we know, for this to become a law, there have to be at least 3 more votes on this bill, on a bill, one in the Senate, and then both the House and the Senate will each have to have another vote on what would presumably be yet a third bill, but that one has to be in identical form, pass both bodies in order to get there. There are plenty of places for this legislation to die between here and that finish line, and I can't help but wondering if Mitch McConnell wants to see it die after he just squeaks a vote through the Senate so that the members of the Senate who want to say, I voted for something, can say they voted for something, even though they won't be able to say it became law.
I think that might be right. There's been a lot of speculation, but I'm not sure even if it is right, it means the bill won't pass. And the reason is this: we've seen at every point.
It might pass by mistake, in other words.
But it's like a collective action problem. Everybody wants to stop it, but nobody wants to be the one who stopped it, right? No faction wants to be blamed, no chamber wants to be blamed, and so this thing keeps moving inexorably forward because nobody wants to take the blame for destroying a bad bill, but having to go before Republican primary voters and say, we're the reason we didn't repeal and replace Obamacare. So yeah, Mitch McConnell might just be trying to get it out of his hands for now, but then you go right back to the same dynamics again. Again, it is the worst possible way and the worst possible reason to craft and pass legislation I have ever watched.
Ezra Klein and Sam Stein, thank you both for joining us.
Thank you.
In Georgia,